In this video, I'm going to share 5 things you need to know when seeking out mental health treatment. I interview the world's best psychologists and psychiatrists for a living. Not only are they experts in their field, but they're experts on navigating the mental health care system so that you can get the best care possible. These tips come straight from double board certified child and adolescent psychiatrist, Dr. Dominic Sportelli. Not only does he work with people of all ages, but he's on the front lines of mental health, working in a psychiatric ER. He also trains other doctors on the best mental health practices. But first, make sure you subscribe to this channel. We are releasing an entire series on the different types of providers and how to find them. You won't want to miss it. Subscribe right here. Let's get started. Number 1, primary care providers are a great first step, but there's an extent to how they can help you with your mental health. This is what you need to know.
I think in a lot of cases people start with the primary care doc, but it's important to recognize when you need to go to a specialist. And in behavioral health, we've talked about this, so important that the diagnosis is the key, a proper diagnosis, right? Because we can only treat what you're being diagnosed with, right? So if that diagnosis is off, and in behavioral health, we don't have a blood test, we don't have an x-ray, so the diagnostician who's saying, you have a major depressive disorder, you have bipolar disorder, you have ADHD, those are very different things. They're going to be treated very differently. So it's best to really get that solid diagnosis by someone that has the most experience with it, right? Because that's going to be that trajectory moving forward of your efficacy and how well you do.
Yes.
So that's why it's important that if you think you might have a behavioral health issue or a loved one has a behavioral health issue, your primary care doc can say, yeah, I agree, you're definitely down, you're a little depressed, but I have a list of specialists that you can go to next.
Number 2, not all therapists are trained in the same types of therapies. Here's Dr. Dom's insight on the different types of therapists you can go and see.
Well, what is the role of a counselor?
Counselor. So counselor's kind of a funny word, right? It's kind of a vague word because you can call a PhD psychologist a counselor, right? However, when we talk about counselors, it's like an umbrella term. And under that umbrella can be a psychologist, a PhD or a PsyD. You also have master's level of training, which means in the United States at least 4 years of college and then about a 2-year master's program in either licensed counselor, like a licensed clinical social worker, or an independent licensed counselor, right? And that's usually a master's level program. And these are people that focus on therapeutic interventions, family counseling, marital counseling, interpersonal psychotherapy, and they provide therapeutic intervention, right?
And are they using things like CBT and DBT?
They certainly can. Yeah, they can certainly do training in that.
So and they're seeing patients?
Sure.
So what's the difference then between a psychologist and a counselor?
So a psychologist can be a counselor. A social worker can be a counselor. That basically means you're seeing patients for psychotherapy.
Understood.
Right? So we're kind of splitting hairs with the words, but the important thing is they're all providing a therapeutic intervention for the patient. And that's why it's so confusing because honestly, I'm a psychiatrist. You can call me your therapist. You can call me your counselor. So the truth is if I'm providing therapeutic intervention for you like psychotherapy and you're seeing me once a week and we're doing CBT, then I'm your CBT counselor, right?
Got it.
So,
or my CBT clinician, or my CBT therapist. I see a lot of therapist websites, probably because this is my job, but sometimes they list every possible thing. They're an OCD expert, a bipolar expert, eating disorders. I go, can you really be an expert at 43 different things? Can you?
Yeah, it's a little bit of a red flag.
Okay.
That's definitely a little bit of a red flag because you can, right? It's like that whole cliche, jack of all trades, master of none, right? And of course, in my clinical practice and knowing colleagues, I do realize that there are people that spend an enormous amount of time studying and learning a certain trade. For example, I have a colleague that is nationally recognized in CBT. And then I have colleagues that maybe did some CME, like a weekend certification in CBT. It doesn't mean that they're not good at it, but are they really a specialist in it?
That they're deep.
Are they really a specialist in it? And if you're looking for a specialist, you really want somebody that's certified. Like for example, CBT, the Beck Institute is kind of like the golden certification, so that might be something you look into. In my private practice, I'll share this with you. I know a handful of psychologists that are so good at CBT and one that's really good at DBT and literally like top of their field with research and experience in those fields, that my patients, I'll say, listen, we have a great relationship and I do a little bit of therapy with you, but I'm going to prescribe your medicines and I want you to see this person for cognitive behavioral therapy once a week. Right, so I'll make that recommendation.
Even though you do cognitive behavioral therapy.
Right, but that's all they do.
Right, I get that.
And that's just different. If you really want the best for your patients, I think that's, in my opinion, that's a really nice mix. So, you'll have a prescriber like myself, and then you'll have someone that really digs in with the psychotherapy.
Number 3, only certain types of mental health professionals can prescribe medication. Here is how to find a prescriber versus a non-prescriber.
As you sort of climb the ladder of care or acuity of care, right, and you start with, let's just say, a therapist, which could be, let's just say, a master's in clinical social work or a licensed professional counselor, right? If that counselor feels like, this looks like a diagnosis of bipolar disorder and it looks like medication would probably help you, then they might refer you to a prescriber. So there are certain areas of the country that have a shortage of prescribers because, we know that medication does help a certain part of the behavioral health community for sure. And we have a shortage of prescribers. So certain states, I believe right now there are about 5 states in certain areas where psychologists can actually prescribe non-controlled substances, meaning medicines for depression and bipolar disorder, for example, but non-addictive medicines or medicines that aren't considered dangerous by the CDS or DEA.
Number 4, if you're looking for more affordable health care, there are some options to be aware of. Dr. Dom breaks these down. Take a look.
Certified peer therapists are people that have experienced what you're going through. And they've been certified by usually the MHA, the Mental Health Association, has requirements. And it's like hours of supervision and training. But what better type of person in so many cases to talk to than someone that's really gone through it, right? So imagine you've had severe depression and not talking to you talk to a psychiatrist and maybe a therapist, but you have a peer counselor that sits there and has been down that dark road.
Who gets it?
And relates to you.
When it comes to actually searching and finding a professional, here is your 5th piece of key insight. It is my absolute favorite tip that Dr. Dom provided. Take a look.
Sometimes people will go see a therapist and they just don't mesh. They don't jive with that therapist. And that's okay. Do you know the average person that develops a good bond with a therapist sees 3 therapists before they actually find someone they like?
I believe that.
Right? So it makes sense. But the important point there is to not get discouraged, right? Because I can't tell you how many people have come to my office and they've said, oh, I've been to therapy. That was terrible. And I'll be like, well, did you try someone else? And they're like, no, I went to this one person. And I'll say, well, listen. And I give them my statistic that some people see up to 3 before they really connect with somebody.
I have to meet 20 people before I find one I like.
So there you go. But at least you keep trying, right? Some people give up after the first, and we don't want that to happen in behavioral health. We really want you to keep going at it. And it may not be the therapist's fault. Maybe their style just doesn't work with you for whatever reason. So I encourage people that if the first therapist, you don't get a good vibe, it just doesn't feel right for whatever reason, then try another one.
Don't forget to subscribe below. We are releasing this full series. It goes way more in depth than what you just watched soon right here on YouTube. For now, here are some parting words from Dr. Dom. Keep these in mind as you continue your search or even start your search to finding the right mental health team for you or a loved one. I'm Kyle Kittleson. Remember, whatever you're going through, you got this.
Every single one of these providers has a very important place in behavioral health. I don't want the viewers to think that one is better than the other or one is more important than the other, because I honestly feel, and this is just my experience in the behavioral healthcare field, that it is a team effort. Just understanding this, it's so scary for people. Look, behavioral health can be frightening. It's a frightening road for people to begin with. Let's take away all of that fear by giving them education in what that path ahead looks like so they can navigate it. It's that simple.